How do you remove the wisdom tooth? Yes, a oral surgeon or a very specialized dental surgeon can remove the wisdom tooth surgically. You have to open up that area, okay, just visualize the tooth, then relieve the tooth from the adjacent bone which the tooth is stuck to. Then, if possible, try to split the tooth into 2 or 3 or 4 parts, remove each part and then suture it up together and then send the patient back. This is a specialized procedure. An expert should remove a wisdom tooth. There are various degrees of difficulty of removing the wisdom tooth. The 4 level of difficulty, that depends on the angulation. That's too technical here, so we don't have to talk about that right now. And what a patient should do after the wisdom tooth removal. Okay, it is very important. We will place a cotton and the patient has to bite on cotton for an hour or so. More importantly, what happens is the patient compliance at home would be a little soft diet for the next 2 to 3 days from the day of removing the tooth, and the patient should come back to us after 7 days to get the stitch removed, and patient should be warned of avoiding gargling for the next 2 to 3 days, and he should be warned that he'll have a facial swelling if a bone is trimmed. So, the facial swelling, how long will it last? Maybe 3 to 4 days or 2 to 3 days, depends on the patient. So, these things have to be very well warned to the patients and then send the patients. If a tooth is sort of infected or the borderline, we just give the patient some antibiotics and analgesics, which is nothing but painkillers, and send the patient back. So, we recall the patient after 2-3 days and then try to clean up that area, irrigate that area, and then reassure the patient. And at this stage, we should assist the excessive mouth opening. Otherwise, what happens? The patients, they'll just close their mouth. So, we just have to assist them to open the mouth after 3 days. And once that is done, we should further reassure them that they can eat normal diet from the 4th day, and then send them back and recall them back after 7 days for the stitch removal. This is a sneak peek into the wisdom tooth. Never be scared of a dentist or an oral surgeon or getting the wisdom tooth removed. What ideally we do is we just give a local anesthesia, numb that area. We give a nerve block, numb the area, and then remove the tooth. During the procedure, it will absolutely be painless. And post procedure, we take care of the discomfort by giving analgesics, maybe 2 types of analgesics or 3 times a day. We alter it according to the severity of the removal. So, it's absolutely very, very safe and pain free, and please do visit and get the tooth removed if at all it is infected. So, many times there are 1, 2, 3, 4, all wisdom teeth will be impacted. There's a lot of questions from a lot of my clients, a lot of my patients. They take opinions from outside and they come and tell us remove only 1 tooth. But in my opinion, purely my opinion, I have found extremely great results in removing all the 4 teeth in the same sitting in one particular go. We should take care that the anesthesia should not be an overdose, and I'm sure we should be well within the limits. And instead of taking antibiotics and painkillers 2-3 times, we can finish it off in one single sitting. And once the tooth is removed, at the same time the swelling will come both the sides and it will all be over. If at all the patient comes even after 2 weeks or 3 weeks, it will not be that comfortable for the patient. So, this my suggestion, my personal suggestion is to remove all 4 teeth at the same time. And if in case a lot of bone relieving or tooth splitting has to be done, we can also think of administering steroids prior to the removal of the tooth, or sometimes after that also. And there are various enzymes which are there in the market which will reduce the swelling of the face post extraction of the wisdom tooth.